Welcome, everybody. We will start shortly. The cameras are off as we are recording it, and we'll upload it in the YouTube channel of ERA4H. The Q&A will be open by the end of Professor Karim Lekadir talk. I'm very pleased to open the 8th webinar of ERA4H with Professor Karim Lekadir. He will join us. Well, actually, he's in the meeting, but I think he has a problem with his camera, so it will take just another minute. But in the meantime, I would like to introduce Professor Lekadir. He's from the ICREA Research Center, which is funded by the government of Catalonia in Spain. He's internationally recognized expert in artificial intelligence for healthcare. His work is focused on developing trustworthy, explainable, and clinically validated AI models, particularly in medical imaging and multimodal data analysis. He was coordinated and contributed to numerous European research initiatives addressing robustness, bias, fairness, and evidence generation for AI systems in real-world clinical setting, and is actively involved in shaping European strategies for responsible AI development in healthcare. In this webinar, Professor Lekadir will introduce the future AI framework for healthcare, drawing on his recent work with Future AI Consortium. And this framework is a consensus-based guideline developed by 117 experts from 50 countries, built around 6 core principles, as mentioned before. And I hope you enjoy this webinar. Again, as I said before, it will be recorded and upload to ERA4H's YouTube channel. And the Q&A part will be open by the end of his talk. So Professor Lekadir, I welcome you for this webinar.
Thank you. Hello, everyone.
Hello.
Let me share my screen.
Yes, please share.
Okay, here we are. Can you see my slide?
Yes, we are. Thank you.
Great. Okay, so thank you again for the invitation. It's a great pleasure to be here to tell you a little bit about trustworthy AI, and in particular to give you some ideas of best practices and methods to achieve trustworthy AI in the healthcare domain, and this is based on the Future AI guideline. So I will do this with concrete examples from different projects in which I participated and also from the literature. So this is the Future AI paper. It was published last year, and as it said, we did this it was a collaborative effort from all regions of the world. So in this talk, first I will tell you what is trustworthy AI according to us. We give you a definition. It's not the only definition. And then I will tell you in the second part some ideas on how to achieve it concretely in the real world. So let's start with the definition. So what is trustworthy AI? And I hope by the end of the talk, you will be able to explain this to your colleagues or to in your surroundings. So trustworthiness. So first of all, trustworthiness. So we understand more or less what we mean by trust or trustworthiness. So let me give you an example from another field, and this is from the field of drugs or vaccination. So if you remember in 2021, a number of vaccines were developed, validated, and provided in the healthcare system in many countries to fight the COVID-19 pandemics. And within a few months, so I think the vaccines came out end of 2020 and early 2021, in many countries, the vaccination started. And very quickly, millions of people got vaccinated. And these are some numbers by May 2021. So very early days of 2021. And the reason most people, the vast majority of people went and got vaccinated and trusted these vaccines because we have experience in developing vaccines. So we know that companies and research labs that develop vaccines, they know how to do this. They know how to develop them. They know how to validate them. But even then, even though it's something that received a lot of success by millions of citizens around the world, there were some people who didn't trust it. So this is an example. I don't know if you can recognize this guy. I'll give you 2 seconds to try to guess. So this guy is a tennis player. His name is Djokovic, and he was kicked out of Australia because he refused to get a vaccine. So he didn't trust these vaccines, and he decided that he would not put this in his body. And it was quite surprising because, again, as I said, we know how to make vaccines and validate them. And also he was taking a big risk by not getting vaccinated because he was fighting to be the best player in the world in tennis. And of course, he was kicked out, and the guy who won was his biggest rival, Rafael Nadal. So, yeah, even in areas where there is a lot of experience, we've been doing vaccination for decades and even for centuries, actually. There are some kings who got vaccinated in the 18th century, for example. So what about in AI? Well, AI is new, is a new technology. So of course, trustworthiness is an even more pressing goal in the field of artificial intelligence because it's new. So what is trustworthy AI, or what is trustworthiness in AI? So let me use an example to start my definition. So this is an AI tool that was published in 2020, early 2020, and it was to detect tumors in breast images, in breast mammography. And it was really amazing. When it came out, it showed that this tool could detect tumors that 6 experts, 6 clinicians couldn't detect. So that was a big shock for everybody. This is where we realized that AI could be something amazing, because it can do, it not only can do what clinicians can do, but perhaps it can even do better. It can detect small tumors that clinicians struggles to detect. So when it came out, it received a lot of attention. It's the paper is one of the most cited papers in the field. But at the same time, surprisingly, the question here would be, well, such a tool, people would run and and adopt it, no, and use it in practice. Well, in reality, it was criticized. So some called it useless. Now, why? Why was it criticized? So it was criticized first because they didn't give a lot of information about this tool, how it was developed. Now, this was developed by a private company, and perhaps they didn't want to share sensitive information, but a lot of scientists went and published this paper and said, well, we need more transparency. We need to understand how these AI tools are being developed. So this is the first principle of trustworthy AI. Trustworthy AI tools have to be transparent. Another thing that was surprising in this tool is that it was doing very well with some difficult tumors, small, subtle tumors, but it was missing some big ones, like in this example. So this is tumors that was detected by all clinicians that participated in the study, but not by the AI tool. So it lacked robustness. So robustness is another dimension of trustworthy AI. So what about universality? Is this a tool that we can use everywhere? Well, we don't know. They did something called external testing. They tested it in 2 places. So this is very, very good. It was one of the first to do this, but it's not enough. Does it mean this tool can be used, for example, in Spain, where I'm based, or somewhere else, or in Asia? That's the principle of universality. Now, going to other examples, I would like to talk about other principles. So another principle of trustworthy AI is fairness. And there have been a lot of research that have shown that baseline AI models, a lot of the time, they can be biased, depending on the data set that was used to train them. So, for example, in this paper, these researchers showed that to detect diseases from chest radiographs, baseline AI models can discriminate, in this case, against female patients, young patients, and Hispanics, for example. Now, this was using really big databases, open databases. So it showed that standard AI models can be biased. Okay, so do we have other principles of trustworthy AI? Well, there is the principle of explainability. I'm sure you all heard about this. It says that the outputs of the AI tool should be provided in a way that they could be understood by the end users, in particular clinicians. Unfortunately, this is still an open question. This is a paper that showed that many of these explainable AI methods, they don't provide clinically meaningful explanations. They provide shortcuts. They use shortcuts as explanations. Traceability, what does this mean? It means that you can have an AI tool today that is accurate, robust, fair, transparent, everything, but perhaps in 1 year, its performance drops or it becomes biased. Why? For 2 reasons. First of all, because the data changes over time. So in a hospital, perhaps they buy a new scanner or they have a different imaging protocol, and this changes the data. This is called data drift. There's another reason is when the definition of the disease changes. So if you remember with COVID-19, there were different waves and different variants, and that changed a little bit the definition of the disease. So that's called the concept drift. So it's important to track the tools over time to make sure that they continue to perform as expected. Finally, a last principle I would like to describe is the principle of usability. Here, what's important to understand is that these AI tools are used by humans, and therefore human factors are important. We need to develop tools that they will like, that they will find easy to use, and that they will use without making too many mistakes. So that's the principle of usability. So if we summarize, these are the 6 principles I mentioned, and if you put them in the right order, you get the acronym of the guideline, Future AI Guideline. Okay, something I would like to tell you is that trustworthy AI and ethical AI are equivalent. Some people use the term ethical AI, and other people use the term responsible AI. If you go principle by principle, you can see that there is a link to a fundamental human right. So, for example, fairness is the right to non-discrimination. Universality is your right to equity, and so on. So when we talk about trustworthy AI, we also talk about ethics. Another thing I would like to say, probably you'd be asking a question here is, why did you select these 6 principles? Perhaps there are other principles, and it's true there are. You hear all sorts of terminology that is used in the field of trustworthy AI. But what we showed in that paper is that these other principles are equivalent to the 6 core principles we selected. So, for example, accountability is linked to trustability. In order to be accountable, you need to track the usage of the tool over time. And safety is related to robustness and so on. So these 6 core principles represent all the key dimensions to take into account when developing trustworthy AI. So that was my definition. My definition and the definition of my colleagues who worked on this paper. Trustworthy AI is AI tools which are fair, universal, traceable, usable, robust, and explainable. And that's it. Now, how do we achieve this? Because it's good to have a principle, but you need then to operationalize those principles in practice, and that's a different question, and it's not an easy one. So how do we do this? So in other areas, to go back to my original example, in drug development or vaccines, they have guidelines. They don't develop these drugs and vaccines in a random way. They have to follow these best practices, these steps that were defined by important bodies like the European Medicine Agencies or the US Center for Disease Control and Prevention. So there are steps, step 1, step 2, step 3, and they follow these steps. And for validation, there is phase 1 clinical trial, phase 2, phase 3, etc., etc. And what we think is that with AI, it should be the same. We should follow certain guidelines. And for a long time, people were developing AI tools the way they thought was best, or the way they could, or depending on their resources, or depending on their understanding of AI. But what we are saying is that we need to follow certain best practices. We need a guideline. And this is where we develop the Future AI guideline. And the Future AI guideline takes a principle, for example, fairness, and transform it into a number of actions. And then each action is transformed into a number of steps, and with also the methods that need to be implemented. So it's to make this more concrete and more actionable. And I'll give you examples. These are the guidelines. These are the steps, the best practices. That are 30. And we define them according to the main stages of, or the main stages of the AI life cycle. So the design stage, this is when you conceptualize your AI tool. The development stage, this is where you start coding and training your model. The evaluation stage, this is where you test whether it works as expected, whether it's trustworthy. And then you iterate. If there are some limitations, you go back to design, development, evaluation. At some point, it's finished, and then you go to deployment stage. So you need to certify the tool typically, and then you need to go to a certain steps so it can be deployed in real-world clinical practice. Now, I'm not gonna show you all the 30 best practices. I'll give you a few examples, and the rest you can find them in the paper. So I'll go with the first one, which is very important. And this is the best practice of engaging stakeholders from different disciplines. Now, I will give you an example to show how important it is. It is important to engage stakeholders, to have a human-centered approach to AI. Now, this was something that took me some time to understand. Yeah, I'm a data scientist, so like all data scientists, when I started working in the field, I was interested in the data, and I was interested in the AI methods. But little by little, I learned about this step, which is stakeholder engagement. Clinicians, patients, ethicists, regulators, and so on. And it's an important one. So in the paper, we explain how to involve the stakeholders. We explain the methods. We say you need to identify the stakeholders, which ones are relevant for your particular application. Perhaps it's a specialist, but perhaps it's a GP, or perhaps it's not a GP, it's a nurse. So it depends on your application. So you first need to identify who are the stakeholders that are relevant for your application. Then you need to inform them about the AI tool so they know what they are supposed to provide you feedback upon. Then you need to set up communication channels, organize co-creation events, and then use qualitative methods to gather requirements and feedback. So surveys, focus group, interviews, and so on. Okay, let me give you an example. This is a project called AI for Heart Failure, funded by the European Commission, and we did exactly that. With the support of the European Society of Cardiology, we organized meetings in Brussels. We invited patients, clinicians, ethicists, legal experts, and so on, and we told them, we want to build a tool to predict complications of heart failure, and we would like you to tell us how we should develop this tool. What are the intended use of the tool? Who should be the end user? When it should be used? How should the interfaces look like? What are the endpoints, the inputs of the AI tools, etc.? And what are the ethical risks? What are the potential issues that we need to anticipate and mitigate? So this is a very important step. So you can do this in person, but you can do this online. There are all sorts of tools that you can do to meet online and discuss these AI tools. This is an example. You can use surveys, and you get responses from representative stakeholders, so they would inform you how the AI tool should be developed. This is important, first of all, to define the intended use and user requirement. Let me give you an example why it's important to do this. So in this project, we spoke to clinicians and patients, and we asked them, what is it that we should predict? We know we want to do secondary risk prevention, so we want to predict complications of heart failure. But can you tell us exactly what is it that we need to predict? Because you guys know, you are the experts and you are the patient. So we asked first the expert, the specialist, the cardiologist, and this is what they told us. They said, we would like to know what is the risk of a particular patient having a modified cardiac function, perhaps a worsened one. Perhaps the thickening is reduced, or the ejection fraction is reduced. And others told us, no, we would like to know the risk of major events like myocardial infarction, a heart attack. And others told us, no, we need to know the risk of mortality. Because if they know that certain patient has the risk of dying within 2 years, perhaps they can change the treatment. They can change the care pathway for that particular patient. So that was what experts told us. But when we spoke to patients, and that's why it's important to also to speak to patients, they told us something different. The patient, what they want, they're not interested in knowing the risk of mortality. They want to know something different. They want to know what is the risk of fatigue or back pain or to go back to hospital. These are different perspectives but they are important because they would motivate patients to adhere to treatments. If they know that by exercising they will be less tired, then perhaps it will motivate them every day to go to work for an hour or something similar. So this is important to have the patient's perspective because at the end of the day, these AI tools are for them. This is from a different project in Kenya. It's a project about developing AI-based obstetric ultrasound screening in villages in Africa, in Kenya in this case. So we spoke to pregnant women, we spoke to their husbands, we spoke to village elders, we spoke to nurses, midwives, and policy makers in those regions. And what did they tell us? First of all, there was a bit of resistance. So because it's a new technology. So engaging them is, in this case, was important to explain them what is it that we are doing and how it could be useful for them. It could allow to predict risky pregnancies, to identify fetuses that need treatment or need some type of intervention, and so on, and also plan the pregnancies, the deliveries, perhaps a C-section or something of that sort. So we showed them the AI tool and we told them we would like to offer you what is done in a standard obstetric clinic, typically with an obstetrician and ultrasound. You can get information about fetal viability, the number of fetuses, the sex of the fetus, the fetal weight, fetal position, etc. And when we offered them this, we talked with the stakeholders. They told us that we would like, that they would wanted to change a little bit the design of the AI tool and remove sex. Why? Because in these places, they have their own culture, their own religious belief, and there is always a concern about selective abortion, which is the abortion of fetuses when the fetus is a girl, which is rare, but it happens. And because in these communities there are certain religious beliefs, they asked us to remove this. And by removing this, we kept all the important information about fetal viability, fetal weight, etc. But we designed an AI tool that was respectful of the local culture. So that's why, again, it's important to involve local stakeholders. It's also important to do this, to define potential sources of bias, to understand how the AI tool could be biased against certain population. Let me give you another example. So again, this is the project AI for heart failure. And we worked with two institutions from outside Europe, one in Latin America, in Peru, and one in Tanzania. But I will focus on the stakeholder engagement in Peru. So these are the meetings they've had with clinicians, patients, and other local stakeholders. And we asked them the question, what sources of bias in Peru do you think we will have and we should pay attention to? We thought they would tell us sex, age, and ethnicity. Ethnicity in particular, because Peru is one of the most ethnically diverse countries in America. So they have different ethnic groups. These are 4 ex-presidents of Peru that have different ethnic groups. And they said, sure, we could test ethnicity, but they were not so excited about this. What they told us is in Peru, they have a different concern for bias. And if you're not Peruvian, and if you don't know about Peru, and if you have not engaged the local participants, you wouldn't guess, huh? And the answer was altitude. So Peru has a huge sea coast in the Pacific, but at the same time, it has a lot of mountains. These are the Andes. So there's a big difference in altitude, and that has a lot of impact on cardiovascular health and disease in Peru. So typically people who live in high up, they have smaller hearts and larger lung capacity, and they have a different definition of the disease of heart failure. So it's important to have a more representative sample according to altitude. Otherwise, if you only take data sets from sea level, from the capital city of Lima, you would build a tool that will be biased. So that's why, again, it's important to engage these stakeholders, because they teach us, they give us very important information that we need to have as data scientists. Another thing to define at the design phase is the explainability needs. Do we need explainability? And if we do, which method should we use? So what we did is we showed different methods to clinicians, and we asked them, do you prefer this method or this one? So instead of me as an engineer imposing a method, I co-create a method with these stakeholders. All right, we move to the second stage, which is development. So now we've designed the tool, we've talked to clinicians, patients, ethicists, we understand what the tool is supposed to do, we understand what are the risks of bias, what are the needs of explainability. So what is the next step? Well, the next step first is to get the right data. We know now what are the different sources of variability and bias. So when we get the data, it's important to get, for example, altitude now, because if we don't have it, if we don't record it, we don't know whether the data set is representative and diverse. And then we check whether it's diverse. And if it's not, we come up with a plan. Perhaps we acquire more data from high altitude towns. But we find there are different ways of addressing this. But without having this variable, these protected attributes, we cannot, of course, assess bias and mitigate it. So this is an important recommendation of the Future AI Guideline. You need to acquire all the different variables that are in particular protected attributes, but also acquire representative data, a data set. Otherwise, your AI tool will be biased and will not generalize. Once we, of course, have the right data, and if we test for bias and we find biases, we can come up with measures against these biases and more generally against the AI risk. So for example, if there is a risk that the AI tool does not generalize to different data sets. So this is a study we did where we took 6 different data sets, and as you can see, they are different because they come from different scanners, different protocols. And with baseline model, there's a lot of errors. These are the red dot. And then we applied some domain generalization technique, and as you can see, the number of red dots reduced significantly. So that's something important to do during development, is to build models that generalize across centers, across data sets, but also across subgroups, across patients. So this is another study that was performed in our lab, where we checked whether AI tools for breast tumor detection in mammography are fair, whether they treat all patients similarly. What we found is that they are discriminating against women with high density breasts. So most women have low density breasts, but about 5% of the population have density breasts. And this is common, for example, in Black women. So we identify the bias and then we try to fix it. How do you fix this? The problem is there is an underrepresentation of high density breasts in the training sample. So we created artificially a larger sample of high density breasts. You can see from these 2 examples, these are the same breast. 1, 2, 3, 4. It's exactly the same breast. All we did is we built a generative AI model to do image synthesis to transform a low density breast to high density breast. And by doing so, we were able to increase the representation of high density breasts. Another recommendation at the development phase is to implement human AI interaction mechanism. The end users can verify the results, can oversee the use of the tool, and make corrections if necessary. A typical example is you have an AI tool for image segmentation in cardiac MRI. Well, here what we could do is allow the end users to have an interface for visual quality control and then perform manual corrections. Now we'll move to the third stage, which is the validation. So our recommendation in the Future AI Guideline is to go beyond accuracy. Accuracy is good, is important, but you need to check at robustness against variation, fairness across group, user experience, that's very important, otherwise users will not use it, clinical utility, safety, explainability, and so on. You need a comprehensive, multifaceted evaluation. And then you need to document all the evaluation results to increase transparency. So let me give you some examples. So here we want to perform an external evaluation. So in this project called RadioVal on breast cancer treatment planning, we included 8 clinical sites from different regions to ensure diversity and to test whether the tool generalizes across different contexts. So we had 3 centers from Western Europe, Spain, Sweden, and Austria, and then we had 2 centers from the widening countries, Europe, so that's Poland and Croatia, and then we included countries outside Europe, Egypt, Argentina, and Turkey. So that's how we recommend and to evaluate whether an AI tool can generalize across sites. What about evaluation of fairness? This is a project where we evaluated fairness for prediction of depression. So this is in the mental health domain. And we built baseline AI models, many of them, and we found that these models discriminate across sex groups. So this is this part of the result, ethnicity, a little bit age, and a lot according to income. So socioeconomic status. So that was the first step. Of course, we evaluated, we found that there was this problem, and then we fixed them, because there are a lot of techniques, for example, resampling, that you can use, and as you can see now, there's overlap across the different subgroups. Other things to evaluate are usability. So how did we do this? In this project, we involved 5 sites, and at each site we involved GPs, cardiologists, nurses, patients, and even IT and data managers. And we asked some questions like, how easy is it to use this tool? You like it? Are you satisfied with it? Are there things you want to improve, and so on? So a user-centered evaluation is very important. And then once we've done this, we need to document all the evaluations. In the RadioVal project that I mentioned before, we created something called an AI passport, where we put all the results of the evaluations over time. Similarly to a normal passport, where you put all information about the person, but also about the trips. But here it's the same. We put all the information about the evaluations over time. In particular, we put the limitations. This way people know what are the limitations we found. So it's okay to develop a tool that has limitations. So for example, medicines have limitations. Sometimes you have a medicine and it cannot be used for pregnant women. And that's okay, but it needs to be said transparently. It's the same here. If you have an AI tool that is biased with certain population, you try to fix it. If you cannot fix it, you report it. You say, I have an AI tool, it works in 95% of the cases. Unfortunately, it doesn't work with this population. You should use a different tool for this population. Okay, so now we go to the deployment stage. So now we have a tool that's been designed, developed, validated through different dimensions. So now let's deploy it. I would say the first thing to do is number 29 here, is to certify the AI tool, so to comply with the regulations. But that's not enough. Before you deploy, something that we recommend is to perform a small local clinical validity study to check, because you could have a tool that works in 10 sites, but it doesn't work in the number 11 because it's so different, for example. So it's always good to continue, do a small evaluation just to check whether you need to perhaps recalibrate your model to the local data characteristics. So here as an example, we built an AI tool for fetal ultrasound image analysis. And we built it in Barcelona. And then we tested it first in Copenhagen, in Europe, and then in 5 African countries. And we found that it works well in Spain. It also works in Denmark because they have similar type of equipment. But it didn't work in any of the African countries: Malawi, Egypt, Uganda, Ghana, Algeria. Well, it's good to know. So now we need to recalibrate the model. So we use something called transfer learning. We modified just the last layers of the deep learning model, and we went from this to this. So there are solutions, but of course you need to check this thing. That's why it's important to check local clinical validity. Another recommendations, once you deploy your AI tool, is to have a mechanism for quality control, because data is not always perfect, and sometimes it can have some inhomogeneities or errors or noise. So there are different ways of doing it. You can do this manually or visually, as I mentioned before, or you can do this automatically. There are tools to detect whether images, for example, that are acquired are of sufficient quality. And if they're not, the AI tool sends a message to the clinician and says, look, this image in particular is of suboptimal quality. We recommend that you repeat the scan, for example, to ensure that the AI tool doesn't get confused and make errors. Okay, so I'm going to stop here. I will now tell you a few takeaway messages from this study. So first of all, I think it's important, trustworthy AI is important. Without trust, people will not use AI to its full potential. Some people will be resistant in the same way that some people were resistant to COVID-19 vaccines. This will be even more significant as a problem. So we need to be aware of the importance of trustworthy AI. Accuracy is good, but we need more than that. And what future AI does is it provides some structure on how to do this. It provides you a structure in terms of the principles. So you've got 6 principles, 1, 2, 3, 4, 5, 6. And then for each, you have a number of recommendations and steps across the 4 different stages: design, development, validation, and deployment. I think, in my opinion, the most important recommendation is multi-stakeholder engagement. It requires some effort. It's easier to just get data and train a model and validate it and commercialize it. But we believe that stakeholder engagement is key to design a tool that is aligned with the needs, with the preferences, with the challenges, with the realities of patients, of clinicians, and so on. It's also important to provide you concrete feedback, requirements, and so on that you would use to build an AI tool that will be eventually accepted because it is aligned with the needs, and then deployed and adopted. So it's really much a trustworthy by design approach for future AI. It gives a lot of focus on the design phase. It says, instead of training a model, then checking whether it's fair or biased, what we're saying is that first think about what sort of biases you could get. Ask the stakeholders, ask the expert, what are the sources of bias? Perhaps it's ethnicity, perhaps it's sex. What about altitude? Because this is an AI tool we want to build for Peru. Once you have that information at the design phase, then later on it's easier. You can acquire the right data, you can check whether the data is balanced and representative, and then you can assess for that particular bias, and then you can apply mitigation measure. And if the bias remains, at least you can report it. The worst scenario is, of course, there is a bias and you don't know. Like, you don't know there is a bias with respect to altitude because you were not aware that altitude could be a bias. So that's why future AI is very much a trustworthy by design approach. And finally, as I said, the AI evaluation should be multifaceted. Accuracy is important, but we need to go beyond. We need to look at robustness, generalizability across sites and context, fairness, I already mentioned, but also explainability. If you build an explainable AI interface, test it. Ask end users, do these explanations help you? Do they make you more confident about the clinical decision making? Does it improve the clinical decision making? Or maybe it confuses you and we shouldn't do it. So it's important to validate all this and validate usability and these AI tools with end users. Finally, trustworthiness continues after deployment, as you need to do quality control, continuous evaluation, auditing, and so on, to make sure that a tool that is trustworthy today is also trustworthy in 1 year, in 2 years, and so on. And if in 2 years it's not trustworthy anymore, it has a problem, you try to fix it. So this is against the paper, Future AI, that was published last year in BMJ Journal. I recommend you to read it. If you have any questions, feel free to contact me, or if you want to collaborate. It's a long paper. It goes well beyond what I described today, with really an emphasis on how to do things. This is the lab, our lab in University of Barcelona. I would like to acknowledge because they helped me generate some of the results, and thank my funding agencies and projects that we use to generate some of the results. And thank you all for your attention, and I'd be happy to take some questions.
Thank you very much for this excellent talk. I had a list of questions, but you actually answered all of them. So thank you again. Let me see if we have questions in the Q&A. I can open the microphone for those who want to ask questions. If anyone would like to raise a hand and ask Karim Lekadir. I don't see any questions. You probably answered all the questions.
There's a question, could you share this presentation with us? Yes, I could send you a PDF later. Definitely.
Okay, and again, it will be recorded and will be uploaded to the YouTube channel. And also I shared the link for your publication, which is really interesting to read in the chat. Please do. I don't see any questions so far.
So there is a question now, I see.
Yeah, there's a question.
Yeah. What could funding agencies do with respect to requirement and calls for proposal regarding trustworthy AI? So yeah, funding agencies now have started to request some plan for building trustworthy AI tools within the project. So Horizon Europe, they do it. So typically they expect to see in a proposal how you're gonna address all these dimensions, how you're gonna ensure that your tool can generalize, how do you ensure that the tool is not biased with respect to sex, ethnicity, that it's explainable, etc. So they do expect you something, and you could, one way to do it is to do it through Future AI. You can tell them, we will follow the Future AI guidelines, we will go through the 6 principles, and for each, this is what we're gonna do. And that's it.
Right.
There's another question. How does the Future AI framework handle the black box progress in deep learning while still maintaining high diagnostic accuracy? Okay. So, yeah, so explainability is still an open problem. But how do you ensure that when you build your explainability, that doesn't affect your accuracy? I think this is a fair question. There are many methods that provide you the explanation. So for example, on the image, it provides you the regions of the image that were used to generate that particular prediction. And it doesn't affect the accuracy. The accuracy stays the same. So you can find in the paper some methods that we listed that can be used and that don't impact accuracy. Something that it can impact, for me, one of the dangers of explainable AI sometimes is that it can provide overconfidence or over-reliance for the end user. So if I'm an end user, I have a prediction that comes from an AI tool, I need to check whether it's a good prediction. I need to check whether everything was correct. When you see an explanation, sometimes it can affect your perception of the results. You see an image and you see an explanation, you see a region of the image that is highlighted, then you can say, well, it worked because it's giving me an explanation. If the explanation doesn't mean that your AI tool worked. All it says is that this is the data that we use to deliver that prediction. So it's very important to pay attention to the human factors. Because at the end of the day, these AI tools are used by humans, and you can have what other people call over-reliance. Explainability can increase the over-reliance, which is not good. Now, going back again to this question, because I like this.
Just before you continue, I would like to add that ERA4H is offering a course on AI tools and implementation of the AI tools. It will happen in March and April. It's already full, but we are going to offer more because we think it's very, very important to offer it to both researchers, clinicians, and all stakeholders. So it's in development. Please continue to the next question.
So just to add something to this question, because I think it's an important one. What can affect accuracy sometimes is fairness. Sometimes you have an AI model that has a certain accuracy, for example, 90, but it's not fair. It's biased against a group. And sometimes you change a bit the model to make it more biased. By doing that, you decrease the accuracy. This is one of the risks of fairness, is that sometimes you increase fairness, you decrease the accuracy. I don't have a miracle solution. I think it's a question of finding the balance. You need to check both. You need to try different mitigation measures, and hopefully, of all the mitigation measures you can use, which are in the paper, one of them will increase the fairness without decreasing the accuracy. Did you build validation tools using MCP to interact with external validators? I know some people are doing it. I have not personally, but I know that this is something that people are trying. How can we validate trustworthiness of AI-generated synthetic medical images? Now, this is a very good question, because a lot of people are using synthetic images to do many things. One of them is to increase the training data set, and sometimes even to validate. So how do we make sure that these synthetic data are trustworthy? Well, there are different ways of doing it. The first one will be to measure the realism of these data sets or the accuracy of this synthetic data set. There are papers that provide these metrics. I could write down later in the chat one paper that provides this type of metric to check how trustworthy are these synthetic data. Another way of doing it is do it with end users. You show synthetic data and real data to end users, and you can see whether they can differentiate them. If they can differentiate between real data and synthetic data, that's not a good sign. They shouldn't be able to separate them. That means the synthetic data are comparable to the real data. But I will provide later a paper that provides a very detailed criteria on how to assess the trustworthiness of synthetic data. Okay, are there other questions?
Yes, they continue.
Okay, let me just, okay, I have it here. So this is the title of the paper. I'll do it this way. I'm going to put it in the chat. Yeah, okay. Now there's a question that says, how does future AI address empowering the clinical users to convince patients for trusting the AI-based care? Well, I think one way that it empowers them is by saying, through the future AI guideline, we were involved in all stages of the AI lifecycle. We were involved at the design phase, the development phase, validation, and so on. So it's not something that was built by an engineer in a lab and then we were given and we were told, now you need to use it. We were part of the developers, or co-developers or co-designers. I think this increases trust. This is one of the questions we get. Who developed this AI tool? If it's only engineer, it's not good. If it's also clinical end users and other, that helps a lot. Yes. How should trustworthy AI be continuously monitored in real-world healthcare settings? I would propose, so this is in the paper, one way to do it is to say, every 6 months or every year, I'm going to do an audit. and I'm going to do an audit. I'm going to take a new data set and I'm going to check whether the AI tool continues to perform according to the different principles of trustworthy AI. I'm going to check whether it's still accurate, robust, whether it's still fair according to groups, and so on, whether it's still explainable. And for example, if I see that suddenly the performance of the AI tool 1 year later is larger in men than in women, so now I know that there is a new bias because the data has changed or the population has changed, and now I can do something about it. I can perhaps recalibrate the model to remove that bias. Are the future AI principles applied to generative AI models as well? I would say yes and no. Yes, overall, but actually we are working to adapt them to generative AI. In fact, we got a project this year that will start soon on generative AI for healthcare, funded by the European Commission, and this will be one of the goals. Okay, have I forgotten any questions? I think Diana answered your question now, if I'm not mistaken.
Yes, you did.
Okay.
And the future principle applied to Gen AI models as well.
Yes, I think there's now another question by Dan. Would you consider appropriate to, instead of trying to increase fairness, just report possible biases, and by that possibly having higher accuracy? Yes, totally. That's a decision you can make. You could say, if I increase the fairness, I'm going to reduce my accuracy so much that the tool will lose its value for most of the population. I would rather keep it to work with 95% of the population, but you report it, as you said, you say, okay, it doesn't work for this 5% of the population. So I don't know, for example, pregnant women or something of that sort. But you need to find a solution for that population. You need to say, for you, we will do something manual, or we will have double reading. We will use 2 radiologists. So it's fine as long as you have a mitigation measure. There's a question by Sarah. Do you think the European health data space regulation will have an impact on trustworthy AI, particularly given the persistent heterogeneity in data standard and collection practices? It could have an impact. Well, certainly it's going to have an impact on data privacy. So data privacy is something that is within the future AI guideline. It's very important. There is still a lack of trust regarding data privacy. And the European health data space regulation would allow to use data for secondary use, for research, and for developing AI tools without moving the data. It's a federated data space, so that on that sense, it will increase trustworthiness. But not only, it will now, people will have access to a lot more diverse data from different countries across Europe, from different places, because the regulation says that we need to comply with the European health data space by 2029, and we need to comply with certain data standards and data formats, which means, in principle, we will be able to use data from everywhere in Europe. Now, that will make AI tools a lot more trustworthy. Today, most AI tools in Europe are used with data, I would say, most of it from Western Europe. Perhaps after 2029, I hope, people will start using data from entire Europe, and it will be data that was a lot more diverse, more representative, taking into account multiple ethnicities, multiple population groups, and hopefully the AI tools will be more trustworthy.
It seems like it really will become a personalized medicine.
I hope
approach.
so. Yes.
So do you think, would you still recommend for young people to go to medical school?
Oh, definitely. There's no doubt
How
about
it will change?
My philosophy on this is that I don't think, I'm sure AI will not replace doctors. I have no doubt about it, at least not in the immediate or even mid-future. I think AI will help them. It will make them better doctors. You know, the healthcare systems are all struggling at the moment. You go to the emergencies, you have to wait for hours for a doctor. You will still have doctors, but instead of them being so busy, so stressed, you know, working long hours, they will have AI tools that will make them more efficient. but they will still be there to take decisions, to take care of you. So my view is that the AI will only help with certain tasks that are tedious, analyzing images, but on the whole process, it would still be doctors.
Thank you for that. And thank you for this very, very, very good and excellent presentation. And for those who are interested in the AI, we will have a lot more webinars on these topics this year. So thank you again.
Thank you so much.
Bye-bye.
It was a pleasure. Keep in touch. Goodbye.
Thank you.